Welcome to the Sankofa Pan-African series. We travel through history's corridors, illuminating Afrocentric narratives. Support us through Patreon or by buying me coffee. Your subscription is a great start, but do hit the bell for notifications so you know when we have new episodes. Share our videos and visit our website sankofastorybooks.com for stories, biographies, Afrocentric nursery rhymes, and other resources for children. Together can change the negative narratives about us. Africa has some of the highest rates of HIV/AIDS in the world, yet the continent faces significant challenges in accessing affordable treatment. This disparity is exacerbated by the practices of big pharmaceutical companies, which prioritize profits over lives. For instance, countries like Kenya are compelled to spend up to 5 times more on debt servicing than on health, leaving scant resources for essential medications and treatments. Winnie Byanyima, Executive Director of UNAIDS, has been vocal about the lack of incentives for innovation in the pharmaceutical industry. She highlights the need for regulating the profits companies make from life-saving medications. The infamous case of Martin Shkreli, who hiked the price of Daraprim, a life-saving drug for AIDS patients, by 5,000% in 2015, serves as a stark reminder of pharma greed. The World Trade Organization rules allow life-saving medications to be traded in the same way we could trade luxury goods. They allow pharmaceutical companies to set the price wherever they want, hoard their technologies, and reap billions at the cost of lives, Byanyima said. These policies expose racial inequalities and discrimination in health, valuing the profit of a few, primarily white individuals, over the lives of black and brown people around the world. To counter these disparities, Africa, the Caribbean, and other developing regions must develop the capacity to produce their own medications. This requires strategic investments in research and development and the exploration of equitable South-South partnerships. Building local pharmaceutical industries and reducing dependency on Western companies can pave the way for more affordable and accessible healthcare. A glaring example of Big Pharma's prioritization of profit over patient care is Gilead Sciences' decision in 2004 to halt the development of a new HIV drug. Internal documents revealed that Gilead delayed the new drug's release to extend the patent life of its blockbuster line of medications. This patent extension strategy allowed Gilead to maintain high prices for its tenofovir-based drugs, despite having reason to believe that the new drug might be safer for patients. If Gilead had pursued the updated drug, its patents would have either expired by now or been close to expiration, potentially lowering costs for patients. The new antiretroviral drug, lenacapavir, is being hailed as a potential game changer in the fight against HIV. However, ensuring its accessibility to poor countries requires compelling big pharma to allow affordable generic forms of the drug. Global health organizations and governments must collaborate to negotiate fair pricing and licensing agreements that prioritize patient access over corporate profits. The fight against HIV/AIDS in Africa and other developing regions is hampered by the profit-driven motives of big pharmaceutical companies. By developing local production capacities, forming equitable partnerships, and enforcing regulations that ensure affordable access to life-saving medications, we can take significant steps toward ending the HIV/AIDS epidemic and addressing global health inequalities.